A renowned obstetrician and gynecologist from Turkey talks about his education and experience. He did his residency at Columbia University in New York, followed by a fellowship in reproductive endocrinology and infertility at Southwestern Medical Center, Dallas, Texas. He's also an active faculty at Yale University. This is a two-part video series. The procedure, IVF.
I did my medical school in Turkey, and after that I did my residency in obstetrics and gynecology at Columbia University in New York, followed by a fellowship in reproductive endocrinology and infertility at Southwestern Medical Center in Dallas, Texas. Following that, since 1992, I have been a faculty at Yale University, where I became the head of the reproductive medicine section for approximately 8 years, and since 2007 I have been the head of the medical women's health department. And for the moment I still keep my appointment as a faculty at Yale University, where I'm a full professor. So every month I go to Yale University to spend a week to see patients also, but also to run my research laboratory and to perform education. Well, as far as the technology and materials concerned, the program here, we use the most up-to-date, cutting-edge technology. There's a very strict regulation here in Turkey as far as how the labs are run. So therefore, we do have to use the most sophisticated techniques in the laboratories, and that helps us achieve a very high success rate in IVF procedures. Just to give you an example, we use 4 different filters to filter the air that circulates in the laboratory at 4 different levels, and use most up-to-date technology again to make sure that embryos are kept in the most appropriate conditions. And all those things do help, obviously, with the knowledge of the physicians and the team to have a very high success rate. As a matter of fact, our pregnancy rates have been over the years remaining well above of the United States average pregnancy rates when you look to age-matched categories. Well, we do get quite a few patients from the United States. We do get quite many patients from Great Britain, Holland, Germany, some from Scandinavia, and especially in Scandinavia and Germany, because there are a lot of restrictions, we do get quite many patients. And geographically neighboring countries such as Romania, Bulgaria, Azerbaijan, Northern Iraq, Macedonia, Albania, even from Greece. Okay. Generally speaking, Turkish people are well known for their hospitality. So therefore, and it's a great tourist destination in this country. So therefore, combining medical care, especially for a treatment such as IVF, where every 3 days you may need just a 15-minute ultrasound, but then you have about 3-4 days free time without any risk to your health. I think Turkey offers a great opportunity, at the same time providing the medical care, but also providing a great touristic destination. The laws, as I mentioned earlier, are quite restrictive in Turkey. There's a very strict control of laboratory environment, how clean and purified the air and other materials should be, making sure that there are never cross-contaminations, and making sure great success rates are achieved. But those restrictions do apply for other aspects also. A third-party reproduction, as we call it, is illegal in Turkey and is not allowed. What are the third-party reproduction? It is donor sperm, donor egg, or gestational carrier. So those 3 services are not available in Turkey.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote.